ensuring access to sexual health services for everyone in the community. That's what Wellington-Dufferin-Guelph Public Health is working towards, and the meaning behind a recent partnership. Let's discuss that with the Associate Medical Officer of Health, Dr. Matthew Tenenbaum. Dr. Tenenbaum, thanks for joining.
Thanks for having me. Pleasure to be here.
Okay, so Public Health has recently partnered with Getakit.ca. Can you tell us a little bit about what the online platform is and why you've chosen to partner up with them?
Absolutely. So Getakit is essentially a new way for people in our community to access certain kinds of testing around sexual health. Testing for things like syphilis or chlamydia, gonorrhea, hepatitis C, HIV. The idea is to have one more open door for people to access in a way that makes sense for them. Right now, people can get that kind of testing through our clinics. They can go to the family doctor if they have one. But this is one additional online way for people who are eligible and who are at risk of these infections to be able to access testing. Essentially, what someone does is they log in and create an account. They go through a brief questionnaire about their risk factors and certain sexual health behaviors that might kind of help us understand what kinds of diseases are worth testing for. And then once they complete that process, they can actually access requisitions for lab testing or even self-collection swabs they can do at home that enable some privacy and might be less stigmatizing than coming into a clinic. All of those results come into us, so they get the continuity of care and your results come back positive.
Okay. Can you talk about maybe what the benefit is of removing barriers that can be present in traditional healthcare settings?
Sure. So one of the critical key factors when it comes to this kind of testing is, it's always been the case that to get this kind of testing, it requires some interaction with a healthcare provider, a nurse or a physician or a nurse practitioner who comes in, asks you questions, assesses you, and then either draws your blood or takes swabs or urine and sends it off to a lab. The idea behind this process is that some of those steps for assessment can be done online using a validated approach that's based upon guidelines and has clinical oversight, so that someone can answer those questions about their risk from the comfort of their home in a convenient way and even do the testing in the comfort of their own home. We know that going to a clinic to answer those questions or do that testing isn't an option that makes sense for everyone because of issues like stigma, issues around physical access, for example, in rural parts of our community, and not everyone has the time of day to go out and have that healthcare interaction on a timeline that makes sense for them. This gives one extra option in our community for people to access this testing in a way that helps reduce the barrier between the intention to test and the actual testing behavior.
Now, I'm not sure how long you folks have been working with this platform so far, but have you been able to provide care to people through it?
Yeah, so we began this partnership. We began planning last year. We launched the partnership officially in November. So we've only been at it for a couple of months. So far, we've had about 30 people use the service. It's a small number so far, but we also are in early days. We are going to be monitoring our numbers and looking at that, hopefully trend up over time, and use that data to help us understand what kinds of interactions are we seeing with this online tool versus who we see in our clinics, just to help us tailor our services more thoughtfully. Not everyone needs to come into clinic, but we want to know who's accessing what service in what way.
Okay, just to kind of piggyback off this topic, I know a recent information report was done on incidence rates of sexually transmitted infections in Wellington-Dufferin-Guelph through Public Health. What were some of the findings of that report?
So we do monitor routinely a lot of the STIs, sexually transmitted infections, that are reportable to us. Things like chlamydia, gonorrhea, syphilis, HIV, hepatitis. And some of the findings in the report that went to our board last night talks about the changes we've seen year on year. In most cases, we haven't seen a significant change. We have seen that our rates typically are much lower than the provincial averages, so we are better off than the provincial average when it comes to the risk of these things in our community. But we also know that we still have to reinforce testing because a lot of these infections are likely to go unnoticed unless someone gets that testing. In many cases, these infections cause no symptoms and allow someone to pass it on from person to person. And unfortunately, that can be a real key dynamic that contributes to the risk of transmission in our community. So we are really encouraging people to get tested on a regular basis if they have new sexual partners.
Okay, a lot of information there. Of course, Dr. Tenenbaum, we certainly appreciate it. Dr. Matthew Tenenbaum is the Associate Medical Officer of Health in Wellington-Dufferin-Guelph. Thanks so much.
Thank you very much.